So let's get started while everybody is returning to their seats. So I'm just going to kick off this session. You've heard John speak about this topic, and you've heard Randall speak about this topic, and you've heard Marshall speak about this topic, and a number of people yesterday foreshadowing. So here's our big working session. So we've divided the room into tables that are marked with a color. Everyone's badge has a star of a particular color, so try and find the table that matches your star. And so what are we going to do with this grand challenge? So this is a challenge issued to our attendees to partner with other health systems and determine solutions for particular barriers around medical analytics in the Commonwealth of Virginia and beyond. And this is really a journey, right? There's a road that we're on. Today, we're working on finding collaborators and thinking about the work that we're going to do. But really, it's the first step in a long journey to our eureka moment down the road. And so there's a number of different ways that your table might approach what we're going to do today. I'll paraphrase Randall and say, the best way would be to find a shared clinical problem, and everything else will fall into place around that. What data, what analytics, what constitutes success. And so I think that's a good way for any table to proceed. But depending upon who's at your table and the kind of issues that they face day to day, we also might want to think about technical barriers that we have to collaboration or things that would accelerate collaboration. And we could try and think about how we could put those into place as an organization and then allow collaboration to form on top of that infrastructure. Or we might want to think about things that we do in our health system or you do in your health system that are particularly effective for us and how we might facilitate sharing those. And we've talked about a number of such projects today. So how to proceed? What should we actually do at these tables? So this is now there's a slide there. Supposed to be a slide there. There's a slide there that's missing, and I'll just do it verbally. So the idea is that every table is going to discuss one of these areas and try and create a path forward that works for them, and then we're going to have a report out session where we're going to go around, with the microphone and have an elected representative from each table talk about what their discussion was and where they got to, and to facilitate everybody being able to move on these topics. Myself and Randall and Christian will move around between the tables and try and spark interesting discussion or just feed into the discussion that's going on and maybe migrate it to other tables to see if they can pick up the spark. So, with that, I think we are ready to begin. There are flip charts that are available if you guys want to write. But we have an hour session now to try and move forward before our report out. So go to it, everybody.